So here we are with the ASICS Gel, which I keep getting this shoe. Now this is like a big sneaker, but it doesn't take orthotics because it has this big bar right here. It's a big bar, and it's like an anti-orthotic bar. It goes all the way around. It's a U pad right here, but it's really thick. You see, it's like an inch thick here. And it's sort of just to prevent orthotics from going in there. You know, so what happens is you put the orthotic in, and this patient needs a very supportive orthotic, but this is a sneaker, and then the orthotic can't go down past that bar. You know, I could fit a stupid, you know, here's the, this is the wrong size, but I could fit some little insole in there, but I can't get an orthotic in there. And here's another ASICS Gel shoe with a deformed, big heel pad in the back. And what's happened is here, like right where you need the padding to be, it's all sunk down, so it overlaps the orthotic. So it actually pushes the foot, you know, forward on the orthotic because this big bump or lump is in the way. And here where you want padding, it's just a divot. You know, the padding has sunk down. So what I'm gonna do now, and the patient has agreed to this, is I'm going to do like a shoe surgery here. I'm going to make a hole and try to get that bar out of there. I'm going to try to do it in such a way so it's comfortable to the patient. So I'm making a hole. And now I'm trying to go in there and see if I can grab this crap, pull it out. I need a bigger hole.
Yeah.
See, here's the stuff. It's this white foamy bar. Pull this crap out. Okay, it's coming out. Oh, look, now I can really get this. Just pull all this crap out of there. And you know, none of the other sneaker companies have this. You know, and they have very good support, like New Balance and Brooks. You know, I have great luck with those shoes. Those shoes are excellent. They don't have this crazy bar. This, you know, look at this. It's just cheap foam rubber. Why is it in here? Ah, Petey. Ha. Now we're having luck pulling this out. You know, why are they putting this in here? It doesn't help us. This patient's leaving on a trip. He needs these orthotics working now. Ah, that's better. Now I can maybe get the orthotic in there. Ah, that's much better. See? See, the foot can be held now without that stupid bar in the way. That's much better. Maybe it's okay, I can trim, because at least I'm not going to lose my, you know, my medial arch on this orthotic. So let me try that now. Okay.
Hi, I'm Sharon Mulbert, and I came to Dr. Janson because I had tendonitis in my right foot, and she recommended the ASICS Gel sneakers for me, which had been very helpful to her patients who have similar issues to mine. But it just wasn't, my foot was still hurting, especially with any kind of walking, even short distances. I felt like I was limping. And she took them apart and we started to look, I hope you can see, that there was a band of extra padding around the whole heel area that was shoving my foot forward and causing the orthotics not to be put in place properly, which caused a lot of pain. We had to pull this extra padding out, and that helped, but I really think until they modify that shoe, it's not something I think I would recommend, and nor Dr. Janson.
So now several months have actually passed, 2 or 3 months have passed since I initially made the first video where I'm cutting the man's shoe, the ASICS Gel shoe. And I also did the woman who did her testimonial, and then a few other patients. We made a little cut and pulled out the foamy, all that wadding that's around the edge of the heel. And it helped everyone very much. Some people had tendonitis from their foot shooting forward, And we even did it on some patients that didn't even have orthotics, and we found it helpful. So if you have ASICS Gel shoes, rather than throw out a new pair of shoes that seem to be bothering you, you could try to salvage the situation. Make a little snip with a pair of scissors, as you saw me do it, and just use like household tweezers, and then pull out some of the foam, and then try the shoe again and see if it helps. And meanwhile, ASICS Gel, which was the big go-to shoe for podiatrists, hopefully will fix this problem and make the shoe the way they used to, which was just with a little thin bar at the top where you need it, where you need the padding, not through the entire heel counter, which just, the foam falls apart very quickly, it deforms. Within 2 or 3 weeks, that foamy, the foam rubber starts to deform. And that's why it causes problems, because it'll just be this weird bulge towards the bottom of the heel bone, and then it shoots the foot forward, and your foot is not in the right place. It doesn't sit properly in the bottom of the shoe. So hopefully somebody can find this helpful, how to fix your shoes. And meanwhile, we'll just be fingers crossed that the company goes back to the excellent shoe that they used to be. All right, thanks for watching. See you in the next video.